Hello, everyone, and welcome back to Freely Nourished, the podcast that empowers you to break the cycle of dieting by teaching you to nourish your bodies well. I am your host, registered dietitian Erin Casey, and I am also the owner of New You Nutrition Counseling, where we believe that you can reach any of your health goals at just about any body size. So if you are ready to let go of that toxic and shameful cycle of dieting and get on board with a program that allows you to incorporate all of your favorite foods, as well as encourages you to enjoy all of your favorite foods, then click the link below. We have our website with all of our course offerings. We have everything from self-guided materials to group courses to individual counseling, all at different price points. And if you are looking at it and you just get a little bit overwhelmed and you're not quite sure what it kind of meets your needs, book a discovery call with us. We would love the opportunity to kind of chat with you. And no, it's not one of those things where we just like shamefully try to upsell you. My goal is very much just to sit down, talk with you, understand what your goals are, and understand, kind of provide you with a little synopsis about what we have to offer, what may be an appropriate fit for you. And I promise it's not car salesman-y. I'm not trying to upsell you or just get your money. It is much more just about trying to make sure that you're getting the resources that are really going to fit you and, of course, your budget best. So if you are ready, click that link below, book a discovery call. We would love to chat with you. And today, what I wanted to talk about is a little something that I hear about this a lot, and I just wanted to kind of give it a little bit of light on the podcast, and that is the difference between type 1 and type 2 diabetes. This is something that, may or may not apply to you directly, depending on whether or not you have diabetes. But I want to just kind of shed a little bit of light because I think, unfortunately, some of these disease states kind of don't get their fair share of the spotlight. And I just wanted to, one, kind of explain the difference between type 1 and type 2 diabetes, as well as explain how different our recommendations are for type 1 and type 2 diabetes. I think very often there's a misconception that they are treated the same. I think sometimes people think that I think most people know that type 1 is kind of a more severe disease state. But I think often there is the misconception that you can go from like a type 2 to a type 1, or like basically like people know that like one is insulin dependent, one is not, but they assume that like you can transition from one to the other. Not the case at all. They are very, very different disease states, completely different causes, completely different treatments medically, but also very different recommendations nutritionally. And I think, unfortunately, and if you do have type 1 diabetes, hopefully you find this very validating to hear. But unfortunately, there's a lot of commentary around what people with type 1 diabetes eat, what they should eat. And it's very toxic. People with diabetes are not immune to the societal pressures of weight management and dietary restrictions. And in many cases, those things can prove significantly more dangerous for them. But that said, a teenager is a teenager, and just because it's dangerous doesn't mean they're not going to do it. So I think that there are things that we can all do collectively to educate ourselves on the differences, but also to just do better in terms of how we comment on other people's bodies, on their nutrition, etc., without passing judgment, and frankly, without speaking out of turn for things we don't understand. So my goal today is to help you understand it, and also kind of give you some tools that if you know somebody in your life or come across somebody in your life with one or both of these diseases, you kind of know, you feel a little bit more empowered to not make mistakes that they hear all the time. So let's start with just the difference between the two. I'm actually going to start with type 2 diabetes because that is far and away the more common disease. So most people that have diabetes have type 2 diabetes. Type 2 diabetes tends to present later in adulthood. So that is actually a hallmark difference. It's if you have to be over 25 for it to even be considered type 2 diabetes. Most people are significantly older than that. Most people are like well into their 50s or 60s before they're ever diagnosed. We used to consider type 2 diabetes to be kind of a quote unquote lifestyle disease. And that was something that basically based on poor eating habits, too much sugar in the diet, not moving enough, etc., that basically being overweight, again, heavy air quotes on the overweight, that those are the things that set you up to develop type 2 diabetes. And if you had good diet habits, you moved well, and you maintained your weight at a quote unquote normal range, you wouldn't get type 2 diabetes. Frankly, that could not be further from the truth. And frankly, we have wasted a lot of decades and research dollars investigating that narrative while conveniently ignoring what is likely the truth, in that it has significant genetic ties. We don't know, like there's no diabetes gene, for example, that we have identified. However, we do know that just maintaining your weight, just having a good diet, and just moving your body do not set you up to avoid type 2 diabetes. We do know that it runs in families, and we do know that to an extent it's a product of age. So kind of part of and I love when the healthcare system, or kind of, the narrative around health presents, chronic diseases as like epidemics, right? There's like an obesity epidemic. There's a diabetes epidemic. They're not epidemic. People's are just like living longer, right? People are just living to ages in better health than they were in past generations. Same with obesity. We changed the narrative or the definition of what constituted obesity in the mid-90s. So millions of Americans literally went to bed overweight and woke up the next morning as obese. That's what contributed to the epidemic, not the fact that people are actually getting fatter. And also some of the narrative about like what was defined as obese, like that started probably 30 years ago in general. And then, and same with diabetes, right? People were very often killed off by things that they're not anymore. So things like heart attacks, things like, pneumonia, or flus, things like cancers and stuff like that were not nearly as treatable or as manageable, or in some ways preventable. We've learned a lot about heart health, and we've learned a lot on how to protect your heart. Therefore, people are living longer and they're living in better health. So yeah, of course, they're more likely to develop diabetes. Your body's going to start aging. That's just what it does. So diabetes is definitely not just a lifestyle disease. There are lifestyle factors that impact it. We'll get into that in just a minute, but I do want to be explicitly clear that it is not something you have eaten your way into. It is not something you have brought on yourself with poor health habits. It is something you are genetically predisposed to. It is something that is likely going to catch up with you with age if you are genetically predisposed to it. And there are things, lifestyle wise, that you can do to either kind of prevent it for longer, manage it better, prevent the advancement of it. But I think another thing I want to point to is that it will advance. So the disease will progress. It is like cancer. It is like Alzheimer's. It is like heart disease. It will progress, frankly, no matter what you do. What we are doing with most of our interventions is trying to slow that down. So we're trying to give you better quality of life. We're trying to give you fewer medications to be on. We are trying to, optimize lifestyle factors such as diet, exercise, not smoking, water consumption, etc., to prolong how long and how healthy you live while slowing that disease process down. But it will progress. I think that's just something that is important to recognize, that one, it's not your fault, and two, once it happens, it's going to get worse. Even if you are making all the right strides, it's not something that, while yes, it can be put into remission, and yes, you can come off of medications and things like that, it is not reasonable for most people to expect their diabetes to go into remission. It just doesn't, the data doesn't work that way. It does happen, yes, but it is very unlikely. It is more likely that you are going to get it under better control, and you are going to slow down how long or how quickly it progresses. But full remission is unlikely. Full need for no medication is unlikely. So I think it's just kind of important to touch on those factors, because I think, again, those are just big misconceptions that are out there in the world. In terms of what those lifestyle recommendations are. Again, I think there are just so many misconceptions out there. I think most people understand enough about diabetes to understand that it is a mismanagement of blood sugar in the body. So there are kind of two main players. One is your blood sugar, and then the other is insulin. Insulin basically helps your body manage blood sugar. It's kind of your partner in crime. There are, in the case of type 2 diabetes, there are potentially two problems. One is that the insulin that you have is not working efficiently. So a lot of times, especially in early stages, people are producing enough insulin to theoretically manage their blood sugar. The problem is the message just isn't getting communicated, or the cycle is just not working in the way that it should. That is a process called insulin resistance. So it's meaning that the insulin is not working the way that it's supposed to be, even though there is enough of it in your bloodstream. The other problem, and this tends to happen in later stages, is that your body is just not producing enough insulin to manage your glucose load. So a lot of our interventions now are aimed at how can we optimize insulin sensitivity, which is like the opposite of insulin resistance. So how can we improve how our body responds to insulin in order to kind of preserve that function of the pancreas for as long as possible, and prevent the issue of not having enough insulin from being an issue. So what that looks like, I think a lot of times, most people, again, kind of know that, okay, it's a mismanagement of blood sugar. A lot of people know that blood sugar comes from carbohydrate, or, sugar changes in our blood sugar come from carbohydrates in the diet. Most people are kind of on board with that. The problem is they kind of take it to, okay, well, if I eat carbs and carbs raise my blood sugar, then I just shouldn't eat carbs, and that'll bring my blood sugar down. No. That's one, not really how your metabolism works. It's quite a bit more complicated than that. And even if that were to work, and sometimes it kind of does in the short term, that's not an overall healthy approach, right? Like, just because it's lowering your blood sugar, we're ignoring all of the other things about your body in which you need carbs to do. So low carb diets are not what we recommend. And so I think it's really important to first and foremost recognize that what we do recommend is a consistent carbohydrate diet. So what that looks like is eating regular meals, and it can be anywhere from like 3 to 5 meals per day. How many and how often, frankly, just varies so much based on the individual. So I think sometimes that's a really confusing point for people. They're like, am I doing it right? I'm only eating 3 times a day. You can be. It depends, what your lifestyle is like, what your needs are, and kind of what your body is capable of doing. And that's, again, where working with a dietitian or another healthcare professional one-on-one can be very, very helpful, because a lot of these recommendations are okay, but they need context and they need nuance. And very often they're kind of presented as these absolute, this is the solution. And it might be for some people, but it's not going to be for everyone. So I think it's just kind of important to recognize that distinction, and really kind of, work with a healthcare professional directly to see what's going to be the best option for you. So what that looks like, again, so anywhere from like 3 to 5 meals per day is kind of the recommendation. And we want to have both a carb at every single meal. So we actually want to have some sort of starch or bread or pasta or rice, potatoes, things like that, some type of starch or grain with every single meal, and then a source of protein with every single meal. Now, that protein does not have to be meat, but it can be a meatless protein. But we want to have some sort of protein with every single meal. That does two things. We want to, and then with the starch, we want to moderate it to about 50 or so grams of carbohydrate with each meal. Again, that is a very generic recommendation, and that is going to change. Like, if I were to counsel you one-on-one, I would make a much more specific recommendation for you. But I say 50 just to kind of give you the idea that, like, we generally want at least that much with each meal. And so I think very often, like, these lower carb diets that have maybe 50 grams of carbs in the whole day, that's not the goal. That is not enough for your body. Your brain alone needs 120 grams of carbs to function every day, to function properly. So 50 is actually a pretty low number. So what 50 grams of carbohydrates looks like, it could be something like 2 to 3 slices of toast. It could be a bagel. It could be about a cup of rice or a cup of pasta. That's kind of a whole, like a kind of medium-sized baked potato. Those are all things that are about 50 grams of carbohydrate. Depending on a little bit on specifics of the product you're using. So I just think it's important to recognize that, like, we do want people with type 2 diabetes to eat those foods, and that those foods are not bad. We just want to have a moderate portion of them, and we also want to have a protein with it. What between the portion size and the protein, what that does is, rather than driving your blood sugar straight up, it helps it slowly rise. So having a controlled amount of carbohydrate means that it can only rise so much in general. So even if you were to eat just the baked potato, a baked potato compared to a baked potato plus rice plus mac and cheese plus, I don't know, cornbread, all of that is going to raise your blood sugar a lot more. Whereas just the baked potatoes there's only so much starch in the potato, for example. So that's going to kind of control how high it goes, but the protein is going to control how quick it gets there, if that makes sense. So we're controlling how high it goes, and we're also controlling how quickly it gets there. What that all does is it slows down how quickly your blood sugar is going to rise and gives your body and the insulin it is producing time to catch up with it. So basically, by not spiking it super high and by not spiking it super quick, your body's not scrambling to catch up with this kind of increase in this quick increase in blood sugar. Now, things like sodas and sweets and candies and stuff like that, you can still eat those things, right? They are going to spike your blood sugar more. Yes. Ways that you can prevent that, as you may have guessed, portion size and pairing it with a protein. So sometimes people know that they're going to have a piece of cake. They may eat like a handful of nuts or something ahead of time, so that they're not just kind of just sending the sugar straight into their bloodstream. They've got a little bit of a buffer. The other thing too is, yes, frequency, right? We want to, of course, it's okay to have, a piece of cake at your grandkid's birthday or something like that, but we don't want to be doing it in large portions and maybe even not every day. That said, it depends. The other big confusing thing sometimes is fruit. Fruit does have sugar in it, but it also has a lot of fiber, and fiber will function very similarly to that protein. So it slows down how quickly that sugar that is also in the fruit will get into your bloodstream. So fruit frequently makes a very good snack. It's not likely, and it doesn't matter what kind of fruit. I think there's all kinds of misinformation out there about, like bananas are bad, berries are good, or watermelon's terrible, but grapes are bad, or whatever. I don't even know what the myths are, but like all fruit is good. Okay. That's just like hard stop. It's all good for you. It will raise your blood sugar maybe slightly differently depending on what it is, but frankly, it's all going to operate very similarly. It's going to be, not nearly as much as, say, a cupcake, but it's also not going to be as slow as, say, a baked potato. That's okay. You can certainly, again, utilize the protein or fats with the fruit to slow that down, and of course monitor the portion size. Same with everything else. So I think it's just, I say all that to say that, one, if you have diabetes and you've been told to follow like a stupid low calorie or low carb diet, don't do that. Consult with a dietitian or at least a diabetes educator that can give you more like tailored advice to help you manage your diabetes. And if you're seeing things on Instagram or Facebook that tell you to cut things out entirely, don't do that either. That is incorrect advice. In fact, the episode that I posted, I want to say 3 or 4 weeks ago, it was about how to spot a weight loss scam. A lot of that applies here too. If somebody's telling you to follow extremes, don't do that. Those are big red flags that somebody either doesn't know what they're talking about, or they're not providing you the full story. Another big reason why I say all of that is that if you have type 2 diabetes, or you know someone with type 2 diabetes, it is not your fault or their fault. It is likely genetics. It is likely age. There may be lifestyle factors that you can improve on. We didn't really talk a whole lot about exercise, but exercise improves insulin sensitivity, so it can improve how well the insulin you have functions. But that again, that's not why you have diabetes. It may be making it worse. It may be an opportunity for you to plug in and help to manage it better, slow down how quickly it progresses, but ultimately that's not why you have it, and it's not your fault. So stop blaming yourself or people that with type 2 diabetes. That's not getting us anywhere, and it's just simply inaccurate. I will say, generally, from a medical standpoint, type 2 diabetes tends to be managed with oral medication first. Metformin is generally the first line of treatment, and then there are several other drug classes that can kind of come in as a secondary agent, either as the disease progresses, or if lifestyle changes and metformin are not enough. Those can be things like GLP-1 agonists, so that would be like Ozempic. It can be DPP-4 inhibitors, DDP-4 inhibitors, which help you excrete more sugar in the urine. And then there's SGLT2 inhibitors that I can't remember what those do, to be honest with you, the pharmacology of them, but they all, I think they improve insulin sensitivity. So those, there's several different classes of drugs that we can use to manage it. And then some people do wind up on insulin, which means, basically, like I said in the beginning, that, if we are insulin resistant and we're not able to produce that, improve the sensitivity to insulin, sometimes your pancreas will just kind of fizzle out and stop making enough insulin, in which case exogenous insulin, like insulin injections, can be helpful. Again, that's not a failure of the person. It's not a failure of you as a patient. It is just simply a fact of the disease will progress. And, some forms of cancer are more aggressive than others. We don't have a lot of understanding as to why that is. It likely has to do with genetics. There may be some lifestyle factors in there, but ultimately we just don't know. What we know is what's in front of us is either a very slow growing cancer or a very fast growing cancer, and we just have to treat it according to what we do know. So I think that's important to note. That said, I think a very big misconception is that, like, if you go on insulin, well, now you're a type 1 diabetic, and that is not true. People who have type 1 diabetes are in fact insulin dependent, but it is a very different disease entirely. So I just talked your ear off for about 15 minutes about insulin resistance and how your pancreas can shut down, and you may need insulin at some point. Type 1 diabetes, that's where we start. So type 1 diabetes is actually a very, very, very different animal. It is an autoimmune disease first and foremost. So what that means is that your body's immune system, or the person's body's immune system, has attacked and effectively shut down their pancreas. So their pancreas, and your pancreas has two main functions. One is digestive enzyme secretion, which just basically helps you digest your food, and the other is endocrine or insulin secretion. The digestive function in type 1 diabetes is untouched. So that means that their body's able to digest and absorb food just fine. It's that endocrine or insulin function that is completely broken. And it is an all or nothing type of deal. There's no like age-related progression. It eventually gets worse. It starts at, the person typically gets very, very sick, and their body just attacks their pancreas for reasons, frankly, we still don't fully understand, and that their beta cell function, or the insulin secreting function of the pancreas, just shuts down entirely. Again, not the person's fault at all. It likely, much like type 2 diabetes, it probably has some genetic components. We definitely see that it runs in families, but we don't have a good handle yet as to kind of where that gene may lie, where, anything like that. We just don't know yet. But we do know that they stop making insulin kind of effective immediately. And because of that, they are fully reliant then on exogenous insulin to maintain their blood sugar at all. Typically, this does not happen later in life. This happens early in life. Usually about up to age 25 is kind of the latest we tend to see it happen. And again, why that is, we don't really know, but that's just the trend that we see. people who had type 1 diabetes used to have to do like multiple daily injections. Like they were checking their finger sticks, multiple times per day, because basically you're constantly in kind of like this yin and yang of, having to count your carbohydrates so what you ate, paying attention to how much insulin you're giving so that that you're covering what you ate, but then also checking your blood sugar to see like what's actually happening in your body. It is a very, very difficult disease to manage. There are a lot of things out now that make it a lot easier. So those are medical devices, primarily in the form of insulin pumps, as well as continuous glucose monitors, or CGMs. So insulin pumps take away the need for multiple daily injections. So rather than giving yourself like a bolus dose, maybe twice a day, and that's kind of like a longer acting insulin, and then adding mealtime insulin every time you eat and having to adjust that every time, for however many carbs you're eating. Now it's all in a pump, and you're able to kind of adjust it on the fly based on kind of what's going on. That said, you also have CGMs, which are continuous glucose monitors. Those are wearable devices that allow you to basically kind of check your blood sugar. So you have something that a lot of times like on the shoulder, sometimes on the hip, sometimes it's on your stomach. You can move it around. You usually change it every 3 weeks or 2 to 3 weeks or so. But it gives you kind of real-time data in terms of where your blood sugar is. You don't necessarily have to stick your finger. You can typically scan it in your phone, things like that. So you basically have kind of it's a lot easier than it used to be, is what I'm trying to say. That said, it's still very difficult to manage, because there's just so many factors that affect our blood sugar levels. So things like stress, sleep, whether or not you're hydrated, your activity level, what you ate is actually a very small part of it. So it's a lot to go through. It is just a lot. And basically, because you are completely reliant on a dose of insulin that you have to give yourself, you have to count every gram of carbohydrate that goes into your body if you want any shot at all at kind of getting that number right. Your blood sugar regulation is quite literally dependent on you getting that number right, because the insulin is not going to regulate itself up or down. What you give yourself is what you've got. It's not going to adjust the way everybody else's body does, and it's not going. Even people with type 2 diabetes, their insulin can adjust. People with type 1 diabetes, it doesn't happen. So with that, since people are dealing with so much, very often these are children. They have, we're worried about them growing and stuff like that. Our goal is to manage the insulin, right? So what we're trying to do is not prevent disease progression, because the disease is already progressed as far as it's going to go. It's never going to get any worse. That said, managing the blood sugar becomes the obstacle, and that is going to be tricky. It's just going to be hard. It's going to be really, really hard. If you know anyone in your life with type 1 diabetes, just, ask them about like what their morning routine looks like between like the first 10 minutes of when they wake up. And you'll be amazed at what some people are living through, even now with all of these devices that do make it a lot easier. It's still real tough. And so the goal is not to prevent disease progression, because the disease has progressed. So the goal is how do we keep the blood sugar stable, but also give you a life, let you live as normal of a life as possible. Because again, a lot of times these are kids, a lot of times they're young adults, and you're already dealing with so much. We don't need to put dietary restrictions on top of it. So we actually don't necessarily recommend a consistent carb diet for people with type 1 diabetes. There's no benefit to that. It's not really going to make managing your blood sugar any easier. You're still going to have to stick your finger or use your CGM, and you're still going to have to either give yourself an insulin shot or use a pump. So like none of those things are going away. So live your life, right? What we do is tell you to eat what you want, count your carbs. You have to count carbs. That's the only thing that you do have to do. Monitor your blood sugar and dose your insulin appropriately. So very often people with type 1 diabetes will hear things at parties and stuff like that, be like, oh, are you allowed to eat that? Like, don't you have diabetes? Yes, they're allowed to eat that. And sometimes people, if their answer is, well, I'm just going to adjust my insulin and blah, blah, blah. Yes, that is the appropriate response. Very, very frequently, people are shamed for having type 2 diabetes because they answer questions like that, which is exactly what they're told to do by their entire healthcare team. But they feel embarrassed or ashamed for, a lot of times people are judging them, saying, look, or you could just manage your blood sugar with diet and like not have to give as much insulin. No, that's not the way that works. They're always going to have to give insulin, and there's always going to be a lot of it. Eating a cookie is not going to drastically change that one way or the other. So eat the fucking cookie. And I just, I get so frustrated for my patients that come in with stories like that, because it's just so invalidating to the rest of their experience. And it's also just kind of like, they don't owe you an explanation. They don't owe you a justification for why they're living their life the way that they are, any more than you owe them that explanation. So they're already dealing with a lot, and eating a consistent carb diet, frankly, would not make their lives any easier. So there's no point in doing it. They're not going through like copiously more insulin or anything like that by eating sweets here and there. What we want is for them to eat and have as normal of a life as possible, in the context of nothing is ever going to be normal for them ever again once they get that diagnosis. So I just wanted to really shed a little bit of light on that, just because, and I don't think that, if you've ever said things like this or ever thought things like this about people with diabetes, please know that I'm not saying this to express anger towards you or any kind of hatred or anything like that. It's just that when you know better, you do better, right? And now that you've heard this, that actually is an appropriate recommendation from a medical professional. And asking questions in kind of a judgmental or slanted way can make that person feel shame about a disease that already makes their life really, really complicated. So, don't do that. But also, you're welcome to ask questions to me. I will gladly kind of give you any answers that you want. You may find that the people in your life are willing to answer questions about it, but just make sure that we're asking them in kind of a non-confrontational, non-judgmental way. It's okay to explore and be curious about it. I don't think any person with diabetes would have a problem like sharing their experience with you, but just know that they don't really owe you an explanation. And it's okay, right? Like we all have done things. I just recorded an episode that I had to correct myself from a previous episode. Like we all do things that we later come to find out are maybe not the most, they're not the best representation of ourselves, and that's okay. What we want to do is not necessarily prevent those from happening when we can, but we don't necessarily want to beat ourselves up for it. We just want to learn better, know better, and do better. So I hope that helps kind of point some clarity in all of this. Again, honestly, as long as this episode was, it was still a very like surface level discussion of diabetes. So if you all have questions, if there's things that you would like me to elaborate on further, please let me know. I would be glad to either make another episode or talk about it on my socials or anything like that. But for now, I will stop talking your ear off. And again, if you either have diabetes, know somebody with diabetes, have questions about diabetes, feel free to engage with us on any of our social media sites, and definitely feel free to reach out about discovery calls and things like that if there's anything you would like from us in terms of helping you break out of that toxic cycle of dieting and diet culture and the narrative it produces. So with that, I will wrap. I hope you all have a wonderful rest of your week, and I will see you next time.